Hi guys, my name is Gianna, and today I'm going to teach you guys how to identify and perform CPR. So a study in 2018 found that only 54% of Americans know how to perform CPR, but only 11% of that 54% actually know how to do it correctly. So today I'm going to teach you the proper way how to perform CPR. A lot of people are unsure of where to start, and it's really important that in a time of need, either you're able to perform it or you're able to show someone how to perform it. So, two big things I want to talk about and really focus on is the difference between a heart attack and cardiac arrest. A heart attack is the beginning stages. So there's a blockage in the heart somewhere and it's causing chest pain, it's making them sweaty. There's all different signs and symptoms that we're going to go through, but they're still conscious. They're able to tell you how they're feeling. And if they don't get medical attention or aspirin, they'll go into cardiac arrest eventually. So cardiac arrest is described as pulseless and not breathing. The blockage has totally stopped the blood flow and has caused the heart to stop. So in your heart, there's a bunch of different electrical signals and they're all out of whack. They're not pumping at the same time, or 1, 2 is usually how it goes. 1, 2, 1, 2. And the whole point of CPR is to get those electrical pulses back in rhythm. So let's talk about signs of a heart attack in a man. They'll have shoulder pain, shortness of breath. Usually you'll see them in the tripod position, so they're hunched over like this, having a hard time breathing. They'll have nausea. Heart attack signs in women are different. They usually have back pain, abdominal pain, sweating, anxiety, fatigue. They'll be extremely tired. Sometimes they'll just say, no, I'm just anxious, but in reality, they're actually having a heart attack. So we'll kind of go through the steps of being able to identify, cardiac arrest. So you'll go up to the victim, and they're gonna be unconscious if they're in cardiac arrest. So you're gonna tap on their chest. Hello, hello, are you okay? Are you okay? They're obviously not gonna respond. So you're gonna check the carotid pulse. So you take your 2 fingers, place them right here on the neck, and you're gonna watch for breathing at the same time for no longer than 10 seconds. Within that 10 seconds, you'll definitely be able to identify right away if they're in cardiac arrest or not. Then you're gonna ask a bystander, if you have one, to call CPR or call 911 and get an AED. Most facilities, whether it be a Walmart, a Target, a grocery store, whatever it is, they will have an AED available. And so you can ask them to call 911, go get the AED, and you're gonna start chest compressions right away. Super important to start it right away. The people who survive are the ones who get bystander CPR. So, really important, you wanna stand on either side of the patient or the victim. You're gonna either interlock your fingers like this, make a fist, whatever's comfortable for you. I don't like to interlock because it'll hurt your fingers. So if you're on your knees, you're gonna use your weight to tilt forward, lock your arms in place, and you're gonna use your weight to go down at least 2 inches, and you're gonna wait for full recoil. So you're pushing the blood out of the heart and letting it fill back up. So that way you're getting a full circulation. So you're gonna keep doing that at a rate of 100 to 120 beats per minute. And a lot of people like to sing songs. I just like to count. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So one cycle of CPR is at least 2 minutes. After 2 minutes, it's recommended that you switch or go as long as possible hands only CPR if it's only one person. So I'll kind of show you guys the scenario, how we do it in EMT school at least. So we'll walk up to the person. Hello, hello, hello. They're not gonna respond. Check for carotid and watch chest rise and fall. There's nothing. So I'm gonna say, you get an AED, call 911, let them know that this patient is in cardiac arrest. Interlock your fingers over the chest, use your weight. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. That's how you do CPR. some facts of CPR. It dates back to 1740, so a long time ago, and only half of the population in America knows how to do CPR properly. 383,000 people go into cardiac arrest each year, and only 88% happens at home. So a lot of this is happening at home, and no one knows how to do CPR. Anyway, thank you guys. Hopefully I taught you guys how to save a life, and show your friends. Thank you.